UConn Health has been working towards receiving this vaccine for months. We knew it was on the horizon. We knew what equipment was going to be needed. We mobilized that in advance. The vaccine is being stored in our -80 ultra cold freezer. The freezer is actually as high as a person, where we have 5 different rows within that freezer. It actually can house well over 50,000 doses if need be.
The vaccine process has moved very quickly. To be able to get to an authorization within essentially less than a year is pretty incredible. I think it's important to know that the part that wasn't rushed was the phase 3 clinical trial, which is really the most important part of the whole process. That really gives us the data that we need to support that the vaccine is effective and that the side effects are as we would anticipate it at a safe level. Often people get some fatigue, maybe even some mild fevers, and that really supports that the vaccine is effective in generating the immune response you want.
I really wanted to get the vaccine to be an example to my department. In the emergency department, we're on the front lines. It's very important that everybody there gets vaccinated, and the best way to do that is to be an example for my colleagues.
We need to be available to take care of the patients, so if we're not vaccinated, we have risk of getting it, and then we're not in the hospital to help the people that need us.
This is a critical piece in turning the tide of the pandemic. We've been battling this for a year. We're very fatigued, we're exhausted, and this is a very optimistic point that we're at to be able to give these vaccines and start to provide that level of immunity that we need to see in the public to be able to kind of move forward and even return back to some of our normalcy that we experienced before the pandemic.